What if the routine medical tests you've trusted for decades could actually be putting you at risk? For seniors over 70, some of the most common screenings, those we've been told are essential, may quietly cause more harm than good. Buried deep in medical journals and often overlooked by doctors, research has shown that certain tests, done purely out of habit, can trigger unnecessary anxiety, invasive follow-ups, and even irreversible complications. Shockingly, studies reveal that nearly all seniors over 70 continue to undergo screenings that provide no real benefit, and in some cases, they may even increase mortality by up to 20%. One particular test can raise the likelihood of complications by 35%, even in perfectly healthy individuals. While the top-ranked test on this list could escalate your risk of a lung collapse by over 25%, all without any prior warning. This video isn't personal medical advice, it's designed to inform. Always discuss your screenings with a healthcare professional before making decisions, but the risks are real, the stories are real, and the science is there. Before we jump in, share in the comments. Have you or a loved one ever experienced a test that caused more stress than answers? Let's start with number 5. Number 5 is the carotid artery ultrasound, a test often offered to seniors as part of stroke prevention. It uses sound waves to check for narrowing or blockages in the carotid arteries, which carry blood from the heart to the brain. On paper, it sounds smart. Strokes are devastating, and early detection seems logical. But for asymptomatic seniors over 70, routine use can create more problems than it solves. The test frequently detects minor plaque that isn't dangerous. Once something appears, doctors often recommend interventions like stenting or surgery, which carry serious risks. A 2014 JAMA internal medicine study found that of 10 seniors tested without symptoms, only 3 needed surgery. Yet nearly 60 underwent further tests or procedures, causing stress, costs, and even strokes from the interventions themselves. The U.S. Preventive Services Task Force advises against routine carotid ultrasounds in asymptomatic adults. False positives and unnecessary procedures pose greater danger than benefit. Exceptions exist. If someone shows symptoms like sudden weakness, speech issues, or vision changes, signs of a transient ischemic attack, then the ultrasound can be life-saving, helping doctors prevent a major stroke. Take Elias, 76, a retired plumber. Feeling healthy, he had the test at a community health fair. Moderate plaque was found, and he underwent stenting. During recovery, he suffered a small stroke, leaving him with slurred speech and right arm weakness, something that would never have happened without the test. For most seniors, the safer route is monitoring blood pressure, adopting a healthy lifestyle, and testing only when symptoms appear. These measures reduce stroke risk far more effectively than routine scans. Now, let's move on to the next test, one that may surprise many men. Number 4 is routine vitamin D testing. At first glance, it seems harmless, a simple blood test to check levels. Vitamin D is widely promoted for bone strength, immune support, and brain health, so testing seems sensible, especially for seniors with limited sun exposure. But for adults over 70 without symptoms, routine testing often adds little value and can even cause harm. A 2020 study in New England Journal of Medicine found that over 40% of seniors with low vitamin D had no real deficiency, yet many were put on high-dose supplements. Taking more than 0 IU daily raised kidney stone risk by 23%, and hypercalcemia risk, dangerously high blood calcium, causing nausea, confusion, and heart problems, by 18%. Vitamin D naturally fluctuates with season, lab methods, and hydration, meaning someone could test low in winter and normal in summer without changing anything. Misreading these variations often leads to unnecessary interventions. Routine testing also doesn't reliably prevent fractures. A 2019 Lancet meta-analysis of 80-plus trials found supplementation did not significantly reduce falls or fractures in seniors without symptoms. Testing makes sense only for those with osteoporosis, frequent falls, chronic muscle weakness, or bone pain. where it guides targeted treatment. For example, Samira, 81, felt dizzy and tired. A test showed mild deficiency, and she was given high-dose supplements resulting in nausea, confusion, and dangerously high calcium. Her dizziness was actually a side effect of blood pressure medication. For most seniors, a safer approach is a modest daily dose of 810 IU without routine testing, avoiding unnecessary risks while supporting bone health. Next up is number 3, a test often misunderstood, especially by older men. Number 3 is the prostate-specific antigen, PSA test, for men over 70. This screening is highly controversial. PSA is a protein produced by the prostate, a walnut-sized gland below the bladder. Elevated levels can indicate prostate cancer, but they can also result from benign conditions like prostatitis, prostate inflammation, or age-related enlargement, called benign prostatic hyperplasia. For men over 70, routine PSA testing requires caution. Prostate cancer in older men often grows very slowly and usually won't cause symptoms or shorten life. Yet a high PSA typically leads to biopsies, which are uncomfortable and carry risks like infection and bleeding. Even when low-risk cancer is found, aggressive treatment such as surgery or radiation can cause long-term side effects, including incontinence and erectile dysfunction. A 2012 New England Journal of Medicine study followed over 180 men for 11 years. Routine PSA screening in men over 70 did not significantly reduce prostate cancer deaths. Instead, it led to a 50% higher chance of diagnosing cancers that would never have caused harm, and a 30% higher chance of undergoing treatments that lowered quality of life without extending it. The U.S. Preventive Services Task Force now recommends against PSA screening for men over 70. Testing should be reserved for men with symptoms, such as difficulty urinating, blood in the urine, or unexplained bone pain. For instance, Ibrahim, 74, felt healthy but got tested after a friend's diagnosis. A slightly elevated PSA led to a biopsy and surgery, causing bladder issues and depression. 5 years later, his cancer had barely progressed and likely never would have. For older men, symptom-based testing and considering individual risk factors is far safer than routine screening. Next, number 2 is a test that seems harmless, but may quietly cause the most damage of all. Number 2 is routine electrocardiograms, or EKGs. This common heart test uses small electrodes to record the heart's electrical signals. It's quick, painless, and often included in standard checkups, especially for seniors. But for adults over 70 without symptoms, routine EKGs can cause more harm than good. Aging hearts often show minor changes in rhythm or structure that are harmless. Yet these blips are often labeled abnormal, leading to follow-up tests, stress tests, echocardiograms, or even invasive angiograms, which involve threading a catheter into the heart. A 2018 JAMA internal medicine study of 16 asymptomatic seniors found that within 6 months, over 10% had additional tests, and more than 2% underwent catheterizations that were unnecessary. Those who had invasive procedures faced a 12% higher risk of hospitalization with complications. Many EKG changes in older adults result from natural aging or medications, not heart disease. EKGs are critical when symptoms appear: chest pain, shortness of breath, or palpitations, but using them routinely can trigger avoidable procedures. For example, Ela, 79, a retired English teacher, had a routine EKG showing nonspecific ST changes. Follow-up stress testing was inconclusive, leading to a catheterization. This caused a brief heart attack and 2 weeks in the hospital, all avoidable. A smarter approach is to reserve EKGs for seniors with real symptoms or those starting heart-impacting medications. For general health, monitoring blood pressure, cholesterol, and lifestyle habits provides far better predictive power. Next, we reveal number 1, the most unnecessary and potentially harmful test for people over 70, yet still included in many annual exams. Number 1 on our list is routine chest X-rays. Quick, painless, and long considered a staple of the annual physical, This test is often offered to seniors during checkups, pre-surgery evaluations, or screening packages. The goal seems simple: catch lung or heart problems early. But for asymptomatic adults over 70, routine chest X-rays can do more harm than good. Here's the truth. These X-rays have one of the highest false positive rates among imaging tests. Harmless findings, old scars, tiny nodules, or age-related lung changes often appear on the scan. Because shadows look concerning, doctors feel compelled to investigate further. That dot can lead to a CT scan, a PET scan, and sometimes a lung biopsy, where a needle is inserted into the lung. For seniors, biopsies carry real risks, including collapsed lung and infection. A 2021 study in Annals of Internal Medicine found that over 35% of seniors who had lung biopsies for incidental X-ray findings experienced complications, often requiring hospitalization. Even worse, over 85% of these biopsies revealed nothing harmful. The U.S. Preventive Services Task Force advises against routine chest X-rays for general screening. Lung cancer screening is recommended only for high-risk individuals, like long-term heavy smokers, using low-dose CT scans, not X-rays. Take Mr. Kyrgyz, 80, a retired bank manager in excellent health who never smoked. During a pre-op check, a routine X-ray showed a small opacity. Despite its likely harmless nature, he underwent a biopsy. His lung partially collapsed, and he spent 4 days hospitalized. The nodule was just an old granuloma from childhood. The test nearly cost him his life. Routine X-rays are unnecessary without symptoms such as chronic cough, unexplained shortness of breath, or chest pain. When used appropriately, they can save lives. But indiscriminate use triggers a cascade of tests, complications, stress, and expenses. A thorough clinical exam, symptom review, and functional assessments provide far more meaningful insight than an X-ray filled with incidental shadows. Detecting disease isn't about more radiation, it's about smarter medicine. All 5 tests we've covered can be life-saving in the right context, but after 70, routine use often causes more harm than benefit. Seniors are particularly vulnerable to the domino effect. One small incidental finding can lead to invasive procedures, hospitalizations, and long-term complications. Modern medicine has made incredible advances, but it has also created a system where fear, habit, and outdated protocols encourage unnecessary testing. You have the power to ask the right questions. Why is this test being done? Will it change my care? If the answer is no, you can confidently decline. Understanding when testing helps and when it harms is one of the most empowering steps a senior can take. Informed decisions lead to better outcomes, a higher quality of life, and more years lived with strength and independence. Have you ever had a test that caused more stress than answers? Do you know which screenings are truly necessary? Share your story in the comments we read and respond to everyone. And make sure to share this video with a loved one who might be unknowingly walking into medical tests they don't need. Thanks for watching.